Cardiac glycosides. Cardiac glycosides are a group of medications derived from plants, such as the foxglove plant, Digitalis purpurea, that have been used for centuries in the treatment of heart conditions. The most well-known cardiac glycoside is digoxin, which has been used for its therapeutic effects on the heart. Here are some key points about cardiac glycosides. Mechanism of action. Cardiac glycosides primarily act on the heart muscle, myocardium, by inhibiting the sodium-potassium pump, Na+/K+ pump, in cardiac cells. This inhibition results in an increase in intracellular sodium levels, which, in turn, leads to an increase in intracellular calcium levels. Elevated intracellular calcium levels enhance the force of myocardial contractions, which can be beneficial in certain heart conditions, especially heart failure. This positive inotropic effect helps the heart pump more effectively. Indications. Heart failure. Cardiac glycosides like digoxin are used in the management of congestive heart failure, CHF, to improve cardiac output and reduce symptoms like edema and shortness of breath. Atrial fibrillation and atrial flutter. Digoxin may be used to control heart rate in patients with atrial fibrillation or atrial flutter. Supraventricular tachycardia. In some cases, cardiac glycosides can help control certain supraventricular arrhythmias. Side effects. Common side effects of cardiac glycosides can include nausea, vomiting, loss of appetite, and visual disturbances. Toxicity. Cardiac glycosides have a narrow therapeutic window, which means that excessive dosing can lead to toxicity. Symptoms of digoxin toxicity can include severe arrhythmias, confusion, and vision changes, blurred vision, colored vision. Contraindications and precautions. Cardiac glycosides should be used cautiously in patients with certain medical conditions, such as severe heart block, ventricular fibrillation, and certain electrolyte imbalances. Regular monitoring of serum digoxin levels is often necessary to avoid toxicity. Digoxin toxicity. Digoxin is a medication used to treat certain heart conditions, such as congestive heart failure and atrial fibrillation. However, digoxin has a narrow therapeutic window, which means there's a relatively small range between a therapeutic dose and a toxic dose. Digoxin toxicity can occur when the drug accumulates in the body to levels higher than what is needed for therapeutic effects. Here are some key points about digoxin toxicity. Symptoms of digoxin toxicity. The symptoms of digoxin toxicity can vary in severity and may include nausea and vomiting, loss of appetite, visual disturbances, for example, blurred vision, colored vision, seeing halos, confusion, fatigue, weakness, irregular heart rhythms, such as ventricular tachycardia or ventricular fibrillation, which can be life-threatening. Causes of digoxin toxicity. Digoxin toxicity can occur due to several factors, including accidental overdose, taking too much digoxin at once or taking an extra dose. Drug interactions. Certain medications can increase the levels of digoxin in the body, increasing the risk of toxicity. Kidney dysfunction. Impaired kidney function can lead to reduced digoxin clearance from the body, increasing its levels. Hypokalemia. Low blood potassium. Low potassium levels can enhance the toxic effects of digoxin on the heart. Risk factors for digoxin toxicity can include advanced age. Older adults are more susceptible to digoxin toxicity due to age-related changes in kidney function, which can lead to reduced digoxin clearance from the body. Impaired kidney function. Individuals with kidney disease or impaired renal function may have difficulty clearing digoxin from their system, increasing the risk of toxicity. Drug interactions. Certain medications can interact with digoxin and increase its levels in the body. Common interacting drugs include diuretics, calcium channel blockers, and some antibiotics. Hypokalemia. Low blood potassium. Low potassium levels can enhance the toxic effects of digoxin on the heart. Conditions such as diarrhea, vomiting, or the use of potassium-wasting diuretics can lead to hypokalemia. Low body weight. Individuals with lower body weight may be more sensitive to the effects of digoxin, potentially increasing the risk of toxicity. Use of high doses. Taking doses of digoxin higher than prescribed or taking an extra dose can lead to toxicity. Diagnosis and treatment. Diagnosis of digoxin toxicity is typically based on a combination of clinical symptoms, physical examination, and measurement of serum digoxin levels. Treatment of digoxin toxicity may include discontinuation of digoxin, stopping further doses of the medication, administration of activated charcoal to limit further absorption, correction of electrolyte imbalances, especially potassium levels, administration of medications to control arrhythmias, if present. In severe cases, antidotes like digoxin-specific antibody fragments, digibind, may be used to bind and neutralize the excess digoxin. Prevention. Preventing digoxin toxicity involves careful dosing and monitoring. It's essential to take digoxin exactly as prescribed by a healthcare provider and to report any side effects promptly. Regular monitoring of serum digoxin levels may be necessary, especially in individuals with kidney dysfunction or those taking medications that interact with digoxin. Antidote for digoxin toxicity. The antidote for digoxin toxicity is digoxin-specific antibody fragments, commonly known by the brand name Digibind or Digifab. These antibody fragments are specific for digoxin and work by binding to the excess digoxin in the body, thereby neutralizing its effects. This effectively reduces the concentration of free digoxin in the bloodstream, helping to reverse digoxin toxicity. Indications for using digoxin-specific antibody fragments. Digoxin-specific antibody fragments are indicated in cases of severe digoxin toxicity, especially when life-threatening arrhythmias, such as ventricular tachycardia or ventricular fibrillation, or severe cardiac symptoms are present. Administration of Digibind. Digibind is typically administered intravenously by a healthcare professional. The dosage of Digibind is calculated based on the patient's serum digoxin concentration, the total body load of digoxin, and the clinical severity of the toxicity. The goal is to use enough Digibind to achieve a therapeutic effect without excessive binding of digoxin, which could lead to decreased therapeutic digoxin levels if the patient still requires this medication for their underlying condition. Monitoring and care after Digibind administration. After Digibind administration, patients should continue to be closely monitored for changes in heart rate, rhythm, and other signs of improvement or deterioration. While Digibind effectively reduces the free digoxin concentration, it does not remove any digoxin that is already bound to tissues in the body. Therefore, it may take time for the patient's condition to fully stabilize.